Welcome to the Agenda 2063 TV show. And thank you for making time out of your busy schedule, Dr. Martini, to be with us. We understand you're very busy, but it's always good to have an expert tell us about something we're not hearing too much about. So you are a senior migration health specialist at the International Organization for Migration. I believe those who want your profile, we will be able to provide them. But we'll get straight to the interview. We're very happy to have you join us. I think let's start off with the very first question, which is very pertinent in the light of the fact that COVID is not totally, totally gone away. People are getting flus and all the rest, so people are still talking about masking up and everything. But we understand what COVID's impact has been on populations, especially across Africa. But in your view, do you believe that we can ever get the African health we want under Agenda 2063 in a complicated post-COVID world where there's a continent that has the highest intracontinental and cross-border migration?
Definitely, thank you for the invitation. Definitely, Africa is making a big progress in terms of the health indicators. But we know that many countries are still struggling with negative health indicators and fragile health systems. In addition, conflict, protracted crises make the progress of the health sector more challenging indeed. And what you mentioned is really another threat that is behind the advancement of the public health agenda for the Africa we want, and is the link between human mobility and health. COVID, we have seen, definitely has spread much faster than any other previous disease and has made an unprecedented impact, not only on trade, economy, and social. But also COVID has shown inequality, with migrants being affected differently and more, and often left behind response and assistance in many of our countries. So the public health agenda we are building in the Africa we want is a bit underestimating the impact of human mobility in the health platform. And as you mentioned, why is so important, and why, if we don't take a timely action, we may impact the Africa we want for the health agenda. You mentioned that Africa has the highest interest mobility, and 80% of Africans, they move across borders, so the neighboring countries. And climate change, urbanization, there are all factors that will continue to increase and the population grow and increase in human mobility. But migration is a positive development. We know because it's increasing the GDP of the country, hosting migrants, and also to the remittances, improving family left behind, etc. So it is in this spirit that the African Union and the Regional Economic Commission, they have committed, and in some of the regions operationalized the free movement of people as a core pillar of the African Union. But however, the health aspect of the regional integration free movement is still neglected. In addition, the public health portfolio and the migration portfolio, they are still working in silos. I'll make you an example. The 2020 Africa Multidimensional Regional Integration Index, that's to achieve and monitor the integration, the Africa we want, it doesn't contain any indicator for health. So how we can go to an inclusive society if inclusion is not also inclusion in the health services? So this is the first gap that we need to address urgently. So policymakers, they should consider the opportunity offered by the vision of Africa we want to strengthen the health systems, scaling up the health systems and social policy, but they can be able to accommodate the citizenship and not citizenship equally, not national. So it's what we say in IOM, the realization of the migrant inclusive and migration aware health systems that should guide the advancement of our public health agenda in Africa. And actually, African Union had saw this gap, and it has addressed with the launch of the new program on migration and health. So to advance this agenda. So there is a positive feeling that we can reach the Africa we want with a health inclusive health systems. However, the point is how to build this strong momentum and a strong agenda, how we can better assist the African Union to operationalize this new program. As IOM, we have expertise, as we know, we have tools developed, large operational in the field. We are making available all our know-how to assist African Union Regional Economic Commission. But however, there is also an important document as reference. This is the migration framework of the African Union. It's an important reference document because it can guide on the migrant inclusion on the health systems. It's really stated that migrants need to be included in the national health plan. So that's important. And the point of how we can translate this continental commitment and guidance to country level and how to operationalize in order that the country level migrants can be included in the migration and in the health plans. And the principle of inclusion of migrants in the health systems is also part of the WHO Global Action Plan for promoting the health of migrants and refugees, which is the unique global guidance on the migration and health. It's also stated in the Global Compact on Migration. In the recent IMRF, which is the global review of the Global Compact on Migration, is reiterated in the national plan. So there are good achievements at REX level that they have included the free movement of people, social protection, but still related to employment issues. So there is still this gap at country level, how we can include migrants in the national health plan system, how we can finance the health of migrants. We need to have more bilateral agreement between countries and focusing more eventually on a regionalization of the health systems. And we may be on the right path.
Okay, I like the point you make about regionalization of the health agenda. I think so far in your very comprehensive answer, you've spoken to a lot about policy, the kind of documents available by the African Union and IOM on how they deal with linking migration and health policy together. But I think what we can both agree on is the fact that COVID has exposed a lot of health cleavages and disproportionate policy alignment by AU member states, which is to really say that we still do not have enough member states of the African Union committing 15% of their budget into health, as they said they would do, as per the Abuja Declaration, which indicates that they should. So what is your view on developments post-COVID, and what can be the impact for the migration health agenda in view of these very glaring, facts that member states still are not committing 15% of their budget to health? They're doing other things that are not necessary.
Yes, that's definitely an important point. Due to COVID, health expenditure in Africa has increased significantly.
Yeah.
The domestic funding, they didn't increase or they remain stagnant in many countries. And that's the first and clear observation.
Yeah.
Health development partners, they contributed during COVID, they are still contributing to the health of the migrants and even in the humanitarian setting, etc. So it's still in the area of migration and health, a more donor-based approach and funding. But in this regard, we should acknowledge the change and the switch to the African CDC leadership that they have made a change to be more independent. The new public health order in Africa is looking at to be in Africa more independent from foreigners. So definitely we have a very high expectation now that domestic funding, they need to increase in order also to reduce this dependence from donor. In the past, even if Africa has had one of the, I would say, best economic growth, and as compared to other regions, African countries, they become richer, the government spending on health finances, it remains stable. So it's also a country priority to invest in well-being. And the financial protection in Africa is still low in many countries. Require majority of the patients to pay out of the pocket, and is resulting in millions of people going toward the poverty line because of health expenditure. So it is a serious concern, not only for migrants, but for the whole population. And majority of the countries in Africa, they are largely far behind to reach the 15% of the Abuja Declaration. Only few are making progress in this regard. And in this term, we may hamper the achievement of the universal health coverage and the SDG 3.8. So countries have difficulties in providing adequate health services and care for the citizens. So this is a point to start. And when this is happening, we know that the government are reluctant also to adapt services for migrants as well. So this is true in Africa, and the current dialogue on universal health coverage is making migrants behind for the moment. So the policy initiatives on the universal health coverage are still country-based, so there is not yet a regional understanding of universal health coverage, and the emphasis is on citizenship. So what we need to look at within this complex scenario, that by the time countries they are advancing the universal health coverage and financing behind that, required behind that, they need to start thinking how progressively include migrants as well. On the contrary, if you will think about failing to do so, it will feed inequality. We will have an Africa where people is free to move, but they are not able to access equal health services. So we need the two parallel free movement of people and the health agenda, inclusive health agenda, they need to go in parallel. We know that there is not one size fits for all. Each country, there are differences in terms of capacity, expenditure, etc. But accelerating the progress toward universal health coverage requires political leadership, and from both sectors, the migration and the health sector, and hopefully a unified agenda, unified vision. Okay. And this is why I can really opportunity for Africa to move from more rhetoric, universalism, leaving no one behind, to make some concrete action, having migration and health working together.
Okay, Dr. Martini. Okay, Dr. Martini, you are making some of us worried. We're feeling that there's not too much hope on the frontier, but in between you can hear there's some optimism that progress has been made, but a lot more needs to be done. As we begin to wind down the interview, what would be your major takeaways to our audience and followers about how IOM is concretely working with member states to advance the free movement agenda, free movement as in the free movement of protocol agenda and the health agenda, because now we cannot run away from health. COVID has compelled us to pay greater attention to health services and health policies. What would you what are some of the recommendations you would want to offer to the world out there on what we need to quickly do? Because there are long-term things that can be done and short-term things that we need to do immediately. What do you think we need to quickly do to make sure that we have a more inclusive health system that includes protection for both migrants and ordinary
of
citizens?
course, there are many priorities. Just to focus on a few of them, at the governance level, this is one of the priorities. We are missing in Africa, in a sub-regional level, a clear framework with priority of the migration and health. The member states, they need to be on top of this agenda and clearly define which are the main priority for them in order as development partner, we can really build on a clear roadmap and framework. So a consultation is needed now. I hope with the partnership of African CDC, WHO and IOM, we can really have member states on board to the consultation. And the second point, which is really a priority, is the health data statistics. The current health information systems in majority of the countries, they do not disaggregate data for migration status. So making it impossible to have reliable data to guide and orient the program. So statistics, and we are currently actually start working and dialoguing with within the existing data, some information on migration and health. We need also to move actually to responsibleize a bit more government also on the humanitarian life-saving intervention currently are under donor-driven. So that a large number of IDP and refugees are present in the region. There are good practices in some of the countries. They have included assistance to refugees in the national include assistance to refugees in this way that kind of
The internet has. Oh no, just as we are. Okay. Okay. Yeah, but I think I caught the yes, yes, I caught the tail end of the point you're making about the governance systems as well. So really, there's a lot of work that we still need to do. I think at this stage, Dr. Martini, I think the conversation is something that we can have a part two of, but for now, we will have to leave it here. Really appreciate the time that you really put into preparing for this, and thank you very much. For all those who followed us, if you have any questions, you can address them to me by WhatsApp or my usual channels so that we can do follow-ups with IOM as well. But I want to really say, Dr. Martini, thank you. I guess you're in Nairobi.